Hi, we are students of the third semester of Mariana University Radiognostic and Radiation Therapy program. And today we will talk about aneurysms. My name is David Insuasi.
Hi, my name is Karen Gomez.
Hi, my name is Sebastián Buccelli.
Hi, my name is Camila Cerón.
Hi, my name is Haider Cordova.
The incidence is estimated to be 6 and 10 cases for 100,000 patient years. Aneurysms of the ascending aorta are the most common within the group of thoracic aortic aneurysms. Disease often result from cystic medial degeneration, which tends to be associated with other pathologic entities. Aneurysms are diagnosed most commonly on imaging studies performed and unrelated indication. Although its natural history remains unclear, it is known that current average growth is about 0 or 1 cm per year.
There are two main types of thoracic aortic aneurysms, true aneurysms and pseudoaneurysms. A true aneurysm affects all three layers of the arterial wall and can be fusiform or secular. A pseudoaneurysm occurs when the arterial wall is damaged and blood collects outside the vessel. The main risk factors are a high blood pressure, arteriosclerosis, smoking, and aging.
Computed tomography angiography or AUCT is one of the most important studies to diagnose the aneurysms of the thoracic aorta. Unlike a rate, it always due to a quality observe the anatomy of the aorta, locate the aneurysms and the measures its size and the extension to perform this study. Intravenous contrast, which improved the visual of the breast ejection angiography of always to obtain 3D reconstruction, facilitating the evaluation of the aneurysms in the planning of the most appropriate treatment for the parent.
Now we will talk about the diagnosis of thoracic aorta aneurysm. Chest is reanimation, signs ash, and mediastinal life, and the alteration in the aortic button or deviation of the trachea. But it can be normal and it does not rule out disease. The most important sign is the acute disease. Use tomography and contrast medium to view the aorta in detail in allows identify the location of the aneurysm, measure its size and extent. The is important for treatment and follow and youth the patient.
What is done after an aneurysm has been diagnosed? Follow-up imaging studies, blood pressure control, risk factor control, medications. When meat surgery be required, endovascular treatment, general difference according to the area of the aorta. Importance of follow-up. Current average aneurysm growth is about 0.1 years. This may serve to explain why follow-up with image studies are important. A table with normal diameters of different segments of the thorax aorta also appears. That very useful for the tomography, but because they can explain that when evaluating an angiography, it is not enough to see the aneurysms. You also have to measure and compare it with the expected diameters of the corresponding segment.
Hola, buenas tardes. Hoy estamos con...
Buenas tardes, con Mónica Delgado.
Bueno, para complementar nuestro video, vamos a contar la experiencia que vivió Mónica con la patología. Cuéntame cómo empezó todo.
Empecé con dolores de cabeza, mareos. De eso asistí con el médico. El doctor me mandó unos exámenes y la verdad un TAC, y la verdad yo no hice eso. Seguí con los mareos hasta que un día yo tuve una fractura cráneoencefálica y de ahí me habían hecho lo de la cirugía del aneurisma, porque la verdad yo esos momentos ya no me acuerdo, porque había estado en la UCI.
¿Cómo se sintió después de la cirugía?
Tuve mareos, náuseas, la pérdida de la memoria y que me estresaba en ese tiempo muy rapidito, o sea, facilito me estresaba.
¿Y ahora cómo se siente? ¿Ha mejorado?
Cambié de neurólogo, el neurólogo me mira cada 6 meses y lo primero que él hace es mandarme TAC y los demás medicamentos y otras citas que él me hace.
Listo, pues muchas gracias por contarnos esa parte de su vida con la patología. Pues te agradezco que hayas tomado este espacio.